Hello, everyone. I'm Dr. Merkel. It's November 13th, 2020. We're in the midst of a COVID pandemic, round number 2 or 3, I'm not sure which. And the governor's thinking about shutting down restaurants. They've mandated mask wearing out in buildings and restaurants, grocery stores, etc. And I want to just share with you a case one of our members had about a patient with colitis and extreme diarrhea. Had it long term. In fact, 12 years she's had extreme diarrhea. And I just made some notes here on this, and most doctors, even the medical doctors, will see this patient with symptoms of colitis, diarrhea, Crohn's, and then treat the GI tract and diarrhea. The medical doctor had prescribed Pepto Bismol for 12 years. 12 years. But the symptoms progressed. Then the medical doctor added a steroid drug. Now, what would other functional medicine practitioners have done? They probably would have tested the stool for bacteria and parasites, or maybe fatty acids or amino acids, and put the patient on probiotics, prebiotics, amino acid, fatty acid, etc. My opinion of that, checking the stool for amino acid and fatty acids is like trying to look in a contractor's dumpster on how to build a house. Now, if this were parasites, I think the medical doctor would have done a stool test for that, although a blood test would have indicated it too. The eosinophils and monocytes will be elevated. It may be a long time to have a parasitic infection, but actually I have seen cases, in fact, coming to my mind right now, 2 extreme cases of parasites that they had had for over 10 years. And we had a simple protocol for that. But that's not what this patient's problem is. Fortunately, this patient sought out an SBN trained member who did the comprehensive testing, and the highlights are noted below. And the doctor sent a ticket wanting some help with this patient. And here's just, I recommended testing and some other things like that. But here's what we found. The CK, creatine kinase, was very high at 258. It should be less than like 200, 180. CK, creatine kinase, indicates the body's breaking down, usually muscle breakdown. And the patient was on a statin, and the cholesterol was still high. Now remember, cholesterol is very, very important for a strong immune system. Now we did hair testing, or the member did hair testing. It showed very high mercury. And the urinary toxic element challenge, which if you're a patient, you can go to our SBN website and learn about it, or Take Two Healthcare, which is my local practice here in Dayton, Ohio. And it's a special test to see if there are hidden heavy metals and toxicities in your system that don't show in the hair. And so this test, it's a urine test, special urine test, showed extreme high levels of bismuth, one of the highest, probably the highest I've ever seen of bismuth, very high lead and very high mercury. Now note, as I mentioned here in red, that very high lead and very high mercury are known to cause diarrhea, known to cause severe gastroenteritis and colitis. Note, Pepto Bismol was prescribed for 12 years. Now the bismuth levels that we see in the urine toxic element challenge have become toxic for this patient. The bismuth continued to accumulate and develop in this patient, and extreme bismuth can cause diarrhea. Now patients take Pepto Bismol, bismuth, to reduce diarrhea, but if you take it for too long and take too much, you end up with bismuth toxicity, which is what this patient had developed, bismuth toxicity, which is why the diarrhea continued to get worse. The mercury and lead and mercury were very high, and those caused diarrhea. Increasing bismuth from the Pepto Bismol also caused diarrhea. Now, due to these drugs, continued exposure to lead and mercury and taking bismuth, the diarrhea and GI got worse, which is why the steroid was now prescribed earlier this year. Overall, the patients are getting worse. The solution is really rather easy. Once the proper testing is done, what's the main thing? Find the source of lead and mercury, which is most likely, as I note here, most likely due to water or local industry. Are you near a steel plant? Is there, what's in the air, what's in the water? But probably the water. And so we got to reduce the body load by trying to find the source of lead and mercury, and that will result in GI and diarrhea resolution. And the CK and cholesterol will likely come down too. Now, I would test the water coming into the house, test the drinking water in the house, and possibly test the drinking water at work. The lead and mercury is there somewhere. Test the water even if there's a filtration system being used. I have tested water systems that were not working. Now, there were other minor problems, nutrient deficiencies, imbalances, and organ dysfunction that need resolved without fixing the toxic heavy metals. All other nutrient, functional, and medical therapies will be futile because they're not the wrong, because all you're doing is treating symptoms. The main problems were lead and mercury. And so the patient suffers needlessly for colitis and diarrhea, and where basically a simple reverse osmosis water filter will likely be her most important treatment. We do all this extensive testing, where a lot of people do extensive testing, but they don't do the proper testing. And all they're doing is treating symptoms. Oh, they've got low adrenals. Oh, amino acid and fatty acids are off, and all these other peripheral things, but they're not finding the main foundational problems, which in this patient was lead and mercury. Now, years ago, I had a 15-year-old boy come in with extreme ulcerative colitis, bloody stools all the time. And I did the proper testing, including the blood and hair, and the boy was getting worse. And he was progressing very rapidly, getting worse, bleeding almost constantly. He went in the hospital to do kind of like an emergency colostomy. The hair results came in while the boy was in the hospital, and the boy's grandmother took the hair results to the hospital because this boy had the highest levels of arsenic I have ever seen. He had also high mercury. Now, the side effects of extreme high arsenic is rat poison, isn't it? It causes things to bleed out on the inside. And I believe this high arsenic was directly causing the extreme ulcerative colitis. But the medical doctors thought the tests were not important. Parents were in a crisis, and they wouldn't even wait a week or two to investigate the toxicity possibilities. And the doctors did a colostomy. How sad, when I really believe, for some reason, this boy is being exposed to arsenic. My final thoughts: we live in the most toxic environment in human history. And how each body responds is unique. Other people in the family might be being exposed to it, but each patient is genetically different, and some respond better, some don't. But you've got to test everybody individually. And here's something very important. Symptoms of disease rarely indicate the cause of the problem. Let me say that again. Symptoms of disease rarely indicate the cause of the problems. Once proper testing is done, then very often the solution is really rather easy, even for very serious problems. Proper testing is taught by myself, SBN, courses I teach, is critical and will provide the best results. Now, here are some of the highlights. This is our urine toxic element challenge. When he just collected 6 hours of urine, we see extreme high levels of bismuth. The level is 4. He's at 77, so that's bad. But then we use a special chelating agent. We see 520. It was going in, but look, his body wasn't getting rid of lead or mercury either. His body had an inability to efficiently eliminate lead and mercury. It's a genetic just problem. He can't get rid of it. But his levels of lead and mercury were extremely high, and they weren't coming out in just regular urine without the added DMSA. And we go to the hair test, and here we have extreme high mercury. And notice lead's not coming out. And only a little bismuth. But when we use, look, we're only 2.5 of mercury. When we use a little DMSA, 62, and the challenge comes out. So this was really an extreme case of heavy metal toxicity and bismuth toxicity. And then here's some of the highlights of the blood test, which this is important. The blood test shows us the CK that something is breaking down, and then we have to find out why. And that's what we did with the testing. The LDH is high, that indicates tissue breakdown too. So these are signs we had to find out why. And heavy metals, lead and mercury, bismuth too. But lead and mercury were the primary causes of this boy's problem. That lady's problem that she had had for over, 12 years. So if this case has been a benefit to you, and hopefully you stay well and avoid COVID. And we're going to be doing a webinar here on COVID, some special testing you can have that you should have done or have your patients do that I believe will really help boost their immune system and help reduce the effects of COVID if or when they get it. Hope you have a great day. I'm Dr. Merkel.